Okay, so switching gears from eyes, although it's still brain-related, but down to the hands a little bit. So Renee and Sylvia, actually I don't see Sylvia's, but Renee, I see you wearing a device.
I am.
Can you tell us about that?
Sure. Cala has developed a wearable neuromodulation technology for the treatment of essential tremor. We spun out of Stanford in 2015, have raised venture capital to fuel our development, and then in September of last year, we launched our first product, and Sylvia was one of our earliest customers and users.
So bioelectrical medicine, I love this idea. I think it's just really exciting. So how do you use it? What's the protocol?
Sure. In our clinical study, we had patients use the device for 2 therapy sessions per day. It's already pre-programmed for a 40-minute stimulation session, so the patient will put the device on. It's a nice, for patients who have tremor especially, we have a Velcro clasp, so it's easy for them to put on. They press the button, and this is a demo device, so it's not live today, and then can use the side buttons to increase or decrease the stimulation settings. In the band itself, which is the more replenishable part of the device that is replenished every 3 months, there are dry electrodes that are placed across 2 nerves, the median and radial nerves.
Okay, and so the patient herself knows how much stimulation to give. I guess this is something you learn over time.
Sylvia?
Yes, you just go ahead and push it until you feel the stimulation down 2 fingers and half of the ring finger and your thumb. And what it does for you is it stimulates it for like 40 minutes, and then it asks you to evaluate it, whether it was change, no change, or better, and you just determine what had worked for you, and you go ahead with that.
Interesting. Okay. So there's a lot of opportunity here, right? I mean, you're focused now on essential tremors, but I know that there is chronic pain, there's hypertension, stroke prevention. So those are all possible indications. And obviously, you've chosen essential tremor as the one to go after first. But I'm curious about depression. So it's sort of, which one of these is not like the others, right? I mean, these are all sort of measurable things. And then depression jumps out as being something quite different and harder to measure. So how does this electrical stimulation address both, tremors, something as physical as tremors and something as ephemeral as depression?
Yeah, let me stop first and let me separate the two. Sylvia, do you want to comment on your experience with anxiety and depression with essential tremor, and then I'll comment on our work in depression separately.
Well, your hands shake, and it's embarrassing, number one. It keeps you from doing a number of things. Eating, brushing your teeth. You brush your cheek more than you brush your teeth. And the water pick, it gives new meaning to water picking your teeth because you water pick the whole bathroom. Just a number of things. I play a lot of golf, trying to put the ball on the tee. Hey, it keeps falling off. And then what happens is you're down there so long, when you get up, you're dizzy. And it's like, okay, what's going to happen now? There's so many things. You try to walk across the room with a glass of water. By the time you get to the table, it's on the floor. Try to fill a pot. And it's very embarrassing to begin with.
Yeah.
And then when you get over being embarrassed and you try to deal with it, then you try to find other things. So I first went to medication, which is what was recommended. I am no longer taking any medication. I just use Cala Health.
Yeah. That's awesome.
That's great.
It's just a game changer. Is it an end all? No. But it makes you so much more comfortable when you go out to eat, when you play golf, when you do anything.
Yeah.
I mean, you still have the tremors. Like it said, it lasts about an hour and a half or something like that. And mine lasts longer, thank goodness. It's just a game changer because people, if you have never had tremors, you don't know how embarrassing, how devastating. You can choose to be depressed if you'd like, and some of us choose not to. Or you can get other methods where they put a hole in your head and all that kind of stuff. Oh, I was so desperate, I went to try that. And fortunately, my friends would tell you that I need to go back and take the test. My head wasn't thick enough. And they said, yeah, right, you need to go back.
Your family disagreed, right? Well, so
So-
let's talk about that, Sylvia. How did you, I mean, so you may not know this, but Sylvia used to be a professional tennis player. So having a tremor would be kind of a career-ending
Devastating.
problem. Yeah. So when did you first notice the tremor, and what impact did it have on your life?
Well, I've had tremors for over 30 years, and I've tried everything. I've been taking a particular medication. I won't mention any of them. Some were very devastating, made me feel like a zombie most of the time, and you try to cover it up. You spend most of your time covering this. It's a devastating disease. And one thing you do avoid doing is going to the restaurant with a child. Because when you start shaking, they're going to let everybody in the restaurant know you're shaking.
Oh, no.
You know, so
Yeah.
so you don't do that. But I mean, I can't tell you how. I mean, I never really speak about it, you know, because it is embarrassing. But everybody's used to me now. My friends will cut my meat up and bring it to the table because you go to cut it up and you're shaking the whole table. People are trying to. If you haven't had it, you know, I could talk all day about it. You just don't know, and we're embarrassed by it, so we don't talk about it.
Well, thank you for sharing that. I mean, it's not easy to get up and talk about something like this.
Yeah.
But what's the scale of the problem? What's the magnitude of the problem? How
sure,
many
yeah.
people have essential tremors?
There are 8 million people in the U.S. that have hand tremors. And by our research, only 1 million of those are Parkinsonian tremor patients, and 7 million of those at least are essential tremor patients. So it's a much larger condition, is why we started there. And the current solutions are very unsavory in terms of, Sylvia talked about the drugs on one end that have horrible side effect profiles, and then the other end is surgery. And so we come in with a very elegant, wearable, non-invasive, non-surgical solution.
Surgery meaning implants.
Implants, correct.
Right. Yeah, no, it's very exciting to see how implant technology is evolving quite rapidly right now. But there are people who can't wait for it to evolve.
Well, we want it to evolve. We want it to be successful because we're mimicking. Our electricity as a medicine is exactly what deep brain stimulation and neuromodulation is doing. We're just able to do it in a different form factor through a wearable, non-surgical path.
And could you eventually embed it in the wrist itself?
That was actually where we thought we would start the technology, and what we were so excited to figure out is that we could actually create the right connections to the brain by just having a wearable device. But the original concept when it came out of Stanford was an implant.
Well, the good thing about this is you can do it when you want to.
Right.
It's not like you have to do it at a certain time or whatever. If you're going to eat with somebody, go to an important dinner, hour before, just do your treatment and you're good to go.
So did you do it before this panel?
No, because I wanted you to see my hands shaking.
Oh, interesting. Well, thank you. I appreciate that. But on a normal day, how often do you use it?
Twice a day.
Twice a day,
sometimes
40 minutes.
3 times, but basically twice a day. And especially if I have to go beat one of my friends in golf, I got to make sure I can putt. Because anything down here, your hands are gone.
How can you putt?
You just do it. You take a
That is
treatment
remarkable.
and you do it. You know, the amount of time you spent being embarrassed, you figure out a way to do it.
Yeah.
And when Cala Trio came along, it's like, you got to be kidding me. This is great. This is really great because I can play golf pretty decently, but I was going to quit because I couldn't
Yeah.
putt.
Yeah.
And now, bring it on.
Yeah, you're betting on your golf games, right? I love that. So Renee, you know, there's a lot of experimentation, shall we say, in the marketplace when it comes to neuromodulation.
Yes.
There's all sorts of people doing all sorts of crazy things to themselves and sometimes other people, sometimes not so grounded in science. I understand you have evidence. This prospect study is pretty exciting, and I'm just curious. Tell us about the study and how did the results meet your expectations?
Absolutely, absolutely. Yeah, we were thrilled. We launched the largest ever therapy study for essential tremor in 26 sites around the United States. We had 263 patients, and it's a connected medical device, so we actually tracked over 21,000 data points from those patients. The study results were published, or were announced actually back in September at the Movement Disorder Society. It hit all of its endpoints. The 2 co-primary endpoints were a physician rating of tremor, and they use a Tetra scale, which often includes some handwriting and some drawing of spirals. And then we also used a patient-rated evaluation of their own activities of daily living, which include things like putting a key in a lock, picking up change, pouring from a mug, all these things that Sylvia knows and has struggled with for years. So we met statistical significance on both of those endpoints. Then the more exciting analysis that we did is that because we have onboard sensors and accelerometers, we were able to take those 21,000 data points and measure tremor from an independent rating. And what we saw is that 92% of our patients had some level of tremor relief. As Sylvia spoke of, we very rarely will see a full resolution of tremor, so there is some residual tremor that happens. But in about half of those patients, they had a 2-log improvement in their tremor, which is very meaningful if you're trying to drink water, pour coffee, et cetera. And so we feel very confident about the largest study ever done and the benefits to patients.
Is there some inevitability as we get older that we become more tremulous in general?
There probably is. Essential tremor is a really unique condition in that we see it very much tied to familial history. Sylvia will speak that her sister has tremor as well, mainly only in the head. But what we do find is that about 75% of the patients will notice it that as they age, and if their parent has it or their older siblings have it, they're much more likely to get it as well.
Mm-hmm. There's a story about Downton Abbey.
The producer of Downton Abbey actually has essential tremor, the creator of Downton Abbey. And in the last season of Downton Abbey, he wrote in the condition to one of the characters. So the butler himself, who has to carry the tray and serve the household, actually has tremor.
Yeah. So they didn't have this back in 1922 or whatever.
No,
it was.
thank goodness we have it today.
And so, Sylvia, is your condition improving over time, or is it each day you reset at 0 and you have to?
No, it doesn't. They tell you that it's going to last an hour, hour and a half, but I used to, do it, and then you sleep all night. And I'd wake up in the morning, and I thought, oh my God, I don't have to hold 2 hands to brush my teeth or water pick or anything, because it will last. Everybody's different. So I don't do it in excess, but it's just nice to be able to brush your teeth and not, even women would relate to this, shave your legs and it's all wavy instead of straight up, and cut yourself. There are just things we take for granted. Or drink water with 2 hands. And now I was telling him a story once. A friend gave me a bottle of water. And I picked it up, and I drank it, and I looked at it, and what's wrong? Is something wrong with the water? I said, no, I just drank that with 1 hand instead of 2 hands and hope I hit my mouth.
Right.
So it's, I can't say enough, because I was desperate enough to have them put the holes in my head, and, and you got to have another surgery and all this stuff you have to do. I went to Stanford to try to have that done, and I was so happy when they came along with this. To help me out. It just helps me out. It doesn't cure everything, but I feel a lot better.
So Renee, how can people get this? Is this something that they can go to their doctor and have prescribed?
Yep.
And how many people have it so far, and what are your goals?
We're early in the commercial launch, so only a few hundred folks actually have the device today. We do require that you get a prescription. So there is a physician who does diagnose essential tremor, writes you a prescription, and we have a right-hand version, a left-hand version. And we have 3 different sizes of bands, a small, medium, and large. And we have a measurement tool for the physician to measure the size of the wrist. So when he or she fills out the prescription and sends it to us, we then take over the fulfillment. So we chose very specifically. It was interesting to hear the last speaker talk about his distribution model. We're very strategic that we chose to be both the manufacturer and the distributor for the Cala Trio, so that we always had that touch point with the patients. Mm-hmm. So we really do put the patient at the center of our delivery model. And surround them with the right kind of care and the right kind of training. So we onboard the patient with their technology, and then we fulfill the bands every 3 months.
And how much is the band? How much does the whole thing cost? What's a year-long subscription?
Sure. We're applying for reimbursement as well. So our suggested retail price is about $3,200. Today we're in a cash pay mode, so we're charging patients less than that, and we're able to do that by Medicare standards. And then the band fulfillment is several $100s a quarter as well.
So you just did a big round of financing.
We did.
$50 million,
Yes.
Excellent investors, Novartis, and
Yep.
Baird and LifeSci Partners and all those guys. And J&J re-upped.
Yes, they did.
Congratulations. And so I'm curious, what are you going to do with the war chest?
Commercialize. Yeah, the big push for us right now is to move into a national launch, probably starting in early 2021. We did submit for our Medicare reimbursement in end of last year, so we are hopeful to find out good news by middle of this year, and then would move into a national phase. So you will continue to see us, from a commercial standpoint, grow our footprint and grow our team.
Right. And how much of that money will you put to R&D for additional applications?
Yeah, we have actually, it's interesting. So electricity as a medicine may not be new, but accessing it through body-worn electronics is. And so we've in-licensed work out of MGH earlier last year for an ear-based stimulation platform. We're working on a few more indications to enhance our wrist platform as well. So we actually do think, you asked early on about the depression work that we're doing, and that's through the work we're doing at the ear, through an ear-based stimulation technology based on the same methodology and thought process we have in the wrist device.
Super exciting.
It is exciting.
Well, that's wonderful. Well,
Thank
Sylvia,
you.
I'm really happy that you found Cala Health.
Me too.
Yeah. And I hope
Yeah.
your golf game just gets really, really, really good.
Really good.
She offered to play with me, and I said, oh, no.
Oh, and one last thing that's really cool about this company. It's one of the few companies in med tech and healthcare where both the CEO and the chief science officer are women.
Yes,
Yeah, we love that.
we like that.
Yes.